Getting the proper nutrition through treatment for blood cancers is crucial. I often tell my patients that you have to think of the food as medicine. Unfortunately, some of the main side effects are nausea and vomiting, and that can affect patients' nutrition.
Side effects related to the treatment may affect someone's eating by decreasing the appetite. Ultimately, that's the first side effect that a patient might experience. Even if they might not experience any other side effects, the appetite is always the first to be affected or compromised. The goal would be to prevent weight loss during treatment. We know that when there's weight loss during treatment, it can increase the risk of the side effects, but also compromise the nutrition and decrease tolerance to the treatment. Patients with suppressed immune systems should really incorporate a general healthy diet, which does incorporate fruits and vegetables, whole wheat, whole grains, lean proteins, and healthy fats.
We try to stress calories, calorie intake. I try to tell patients that their body is actually hypermetabolic through these types of therapies, and they are actually requiring more calories than they would normally.
If the patient feels that they're not wanting to eat, we do work with the patient closely to see what would be a realistic goal for the patient. So even though the patient might not be able to tolerate a large quantity of food at one time, we do encourage the smaller frequent meals for our patients. Food safety is very important during cancer treatment because we know that the patient's blood counts can fluctuate throughout, and we want to make sure that there's no risk of infection, more specifically foodborne illness.
The food that I was allowed to have it had to be cooked. I can't have sushi, I couldn't have, raw stuff. Anything that people or restaurants or whatever have that they don't clean right away, I can't have.
Some food safety guidelines include making sure that all meat is cooked throughout, nothing undercooked or raw just for the risk of contamination. We also want to make sure that our patients are washing their fruits and vegetables very well. Any dairy products, we do ask that the patients use pasteurized dairy products only.
Proper nutrition can help our patients manage side effects, improve healing, and prevent complications down the line.